have some interesting slides that are going to show us a little bit of that, about how that fat is inserted, taken from the abdomen and put in the hand as well.
Well, fat and a needle. It's amazing what we can do with a fat and a needle. If we show the slides here, if we just make needle holes in the skin that leave no scar, we can create an alternating pattern of slits, which then allow mesh expansion. So you can now stretch the tissue because you've created that mesh expansion pattern. And then you put fat in those little holes, and when the fat survives, it really takes hold, regenerates, and suddenly you gain tissue. You start with a piece tissue, and you can increase 30% increase in tissue length with just a needle and an incision. So if you look at a wound defect that you couldn't close, we go around it and we make simple needle holes, leave no scar.
No scars.
No scars. The needle leaves no scars. Size of an intravenous. You rarely have a scar from an intravenous. And then by staggering these slits there, and we can allow this to open like you make slits in the paper and allow it to expand, and then you create this mesh band that expands. It creates tiny little pigeonholes, if you want, alveoli, boxes where you can put fat. And when the fat survives in those little scaffold, that scaffold basically, you've regenerated tissue.
But I want to see the before and after. Let me see that.
This is a typical Dupuytren contracture, like Dr. Eaton showed, as talked about. You can't open their hand, that cord, that nodule is in there. And what we do here, we put the contracture under tension in the operating room, and with multiple needle sticks, just like I showed that slide, we create a mesh pattern that allows it to expand, and then that allows the fingers to open, and we'll put fat in between.